Blood pressure is the pressure circulating blood exerts on the walls of the arteries. When the heart pumps, this pressure is called the systolic pressure. When the heart relaxes, this pressure is called the diastolic pressure. Systolic pressure is always higher than diastolic pressure. Blood pressure is measured in millimeters of mercury, or mmHg. A blood pressure reading is written like a fraction, with the systolic pressure over the diastolic pressure. It is normal for the blood pressure to vary throughout the day, within a relatively narrow range. Be aware of the range of blood pressures that are considered normal for each of the people in your care. Also, be aware of factors that can cause temporary increases or decreases in the person's blood pressure, such as exercise, emotions, time of day, or a change in position, and report these as well. If you measure a blood pressure that is significantly higher or lower than the person's normal blood pressure, be sure to report this to the nurse. To measure a person's blood pressure, begin by washing your hands and gathering your supplies: a sphygmomanometer with the correct cuff size, a stethoscope, alcohol or antiseptic wipes, and a pen and paper. Follow your preparation steps. Knock, introduce yourself, greet and identify the person, and ensure the person's privacy. Explain what you are there to do and ask permission to continue.
I'm going to check the measurement on your blood pressure. Is that okay?
That's fine.
All right.
Adjust equipment as needed for body mechanics and safety. If the person is in the supine position in bed, position the person's arm so that it is resting comfortably, palm up, on the bed. If the person is in a chair, have the person sit with both feet flat on the floor. Position the arm so that it is fully supported and level with the person's heart. Clean the diaphragm and earpieces of the stethoscope with an alcohol or antiseptic wipe. Turn the screw on the bulb to the left until it stops. Squeeze all of the air out of the cuff. Adjust the person's clothing as necessary to expose the upper arm. Locate the person's brachial pulse. You will find it on the inside of the elbow.
Now time for the cuff.
Place the cuff on the person's arm over bare skin. The arrow on the cuff should be placed directly over the person's brachial artery. The bottom edge of the cuff should be about 1 inch above the person's elbow. Wrap the cuff around the person's arm snugly and smoothly. Fasten the cuff. It should be snug enough to stay in place, but not uncomfortably tight. Put the earpieces of the stethoscope in your ears. Place the diaphragm of the stethoscope firmly over the person's brachial pulse. Turn the screw to the right. Pump the bulb to inflate the cuff to between 160 and 180 millimeters of mercury. Alternatively, inflate the bulb until the gauge reaches 30 millimeters of mercury above the last recorded systolic pressure. Slowly turn the screw to the left to gradually let the air out of the cuff. The gauge should lose about 2 to 4 millimeters of mercury per second. If pulse sounds are heard immediately after starting to deflate the cuff, you must completely deflate the cuff. Then, re-inflate the cuff to no more than 200 millimeters of mercury. Repeat the cuff deflation process. Listen for the pulse sound. The reading when you first hear the pulse sound is the systolic pressure. Remember this number and continue to slowly let the air out of the cuff. You will hear the pulse sound stop. The reading at this point is the diastolic pressure. Remember this number and quickly let the rest of the air out of the cuff.
Excellent, Mr. Green. It's right where it normally is.
Remove the cuff from the person's arm. Record the person's name, the time, and the blood pressure measurement. Then, perform your completion steps. Ensure the person's comfort and safety. Clean up the work area, wash your hands, and report and record your observations.